Good day. I will give a lecturette with the title Psychological Distress Experienced by Filipino Cancer Patients. Psychological distress is a general term used to describe unpleasant feelings or emotions that impact a person's level of functioning. In other words, it is a psychological discomfort that interferes with a person's activities of daily living. In all phases of cancer journey, there will be psychological distresses. Each cancer patient has his or her own unique set of psychological distresses. No two people experience one event the exact same way. Psychological distress is a subjective experience. That is, the severity of psychological distress is dependent upon the situation and how a person perceives it. One can think of psychological distress as a continuum with mental health and mental illness at opposing ends. As one continues to experience different things at different times, one can travel back and forth on the continuum at different times throughout one's life. There are so many variety of psychological distresses. They usually occur in combination. Last year, 2020, I passed out a survey or questionnaire to my cancer patients to study the psychological distress experienced by them in the course of their cancer journey. Although not many have answered the survey, there were at least 40 patients. The assessment of the My Cancer Journey of patients with cancer was set up for three purposes. One, to survey the usual psychological distresses being experienced by Filipino patients in various phases of their cancer journey, their degree or severity, the coping tactics utilized, and their effectiveness and outcomes. Two, by asking patients with cancer to do this self-assessment, hopefully to form part of their continuing psychosocial therapy. And three, to cull local data and information to be used by me for the psychosocial therapy of my cancer patients. All cancer patients will have different phases in the cancer journey, from suspect of having cancer to survivorship to end of life, in which there is an inevitable triggering of psychological distress, which can be of any type and which may be of varying degree or severity. Patients have different ways of coping with the distress. Patients have different ways of surviving cancer. Patients have different ways of preparing for the eventuality. For the purpose of the survey, to simplify things, I just classified the cancer journey into 6 phases. Phase of cancer diagnosis, cancer treatment, after cancer treatment, in remission below 10 years from the treatment, during survivorship, in remission 10 years or more from the treatment, phase of cancer recurrence, and phase during curtain call or near the end of life. There were several cancer patients who answered the survey. 3 for the phase of cancer diagnosis, 7 for the cancer treatment, 15 for the remission below 10 years, 7 for the remission after 10 years or 10 years or more, 6 for the cancer recurrence, and then 7 for the curtain call or near end of life. As I said, to simplify things, I just classified the cancer journey into 6 phases. Other authors have more detailed categorization or classification of the stages or phases in the cancer journey. Some have 15, some have 20 phases. In each phase of the cancer journey where the cancer patient respondent is currently in, I ask them to recall what type of psychological distress they experienced before, the degree of distress, how they cope with it, and what is the current status of the distress and coping mechanism. Instead of a freewheeling answer describing the type of psychological distress, again, to simplify my survey, I used the following big category choices for them to tick with some follow-through subcategorization and also leeways to expound further to get more detailed information. The big category choices are the following: fear, sadness, personal apprehensions, and psychosocial apprehensions. I will present the subcategorization later on as I present the findings. General findings. All cancer patients in all phases of journey experience the following in varying degrees. Fear, which include general fear and fear of death. Sadness, which include general sadness, anxiety, and depression. Personal apprehensions, which mean exclusively confined to the cancer patients. Psychosocial apprehensions, which mean influenced or affected by social factors. In terms of fear, great majority, 99%, had general fear, 72% had severe to extreme fear of death at the time of diagnosis of cancer. In terms of sadness, great majority, 99%, had general sadness, majority had anxiety more than depression at the time of diagnosis of cancer. Common symptoms of anxiety: excessive worry, sleeping problems, irritability, and muscle tension. Common symptoms of depression: depressed mood, sleeping problems, lack of energy. Fortunately, only a few patients had suicidal thoughts. In terms of apprehensions, majority had personal apprehensions more than psychosocial apprehensions. Common personal apprehensions include treatment and their side effects, no guarantee of good outcomes of treatment, medical expenses, self-image, job, and occupation. Common psychosocial apprehensions include family, relationship with people in job or occupation, paying medical bills with other people's help. In terms of coping tactics, great majority, or 99%, used and found effective is spiritual trust, praying to God, bargaining with God. Acceptance, finding a trusted and in a physician with confidence. Family support, suppressing by keeping oneself busy, such as with work, hobbies, and sport. Fortunately, few needed psychiatrist or psychiatric drugs. The other coping tactics found effective were the following: hoping for the best in everything in diagnosis and treatment and in coping psychological distresses, reading extensively on my cancer, asking and talking to as many physicians as needed, looking for physicians who can explain well my cancer diagnosis and plan of treatment, looking for physicians who can provide psychological support, asking and talking to other cancer patients, joining a cancer support group, and making an intentional living plan. Note, an intentional living plan is not a life insurance plan and not a memorial plan. It is something that will guide the patients in living fully a life with cancer. From this survey, it seems that the best coping tactics are the following: spiritual trust, acceptance of the cancer, trust in a competent and compassionate physician, support from loved ones and significant others, and keeping oneself busy with something to do. I hope all of us can learn something from this survey in our personal cancer journey. It is understandable for all cancer patients to have fear, sadness, personal apprehensions, and psychosocial apprehensions. They will vary from persons to persons or from patients to patients. However, it is possible to manage these psychological distresses through the various coping tactics used by the veteran cancer patients. There are a lot of coping tactics that cancer patients can use. Each patient will have his or her unique way of coping. There are no wrong ways as long as the coping tactics utilized succeeded in resolving or controlling the psychological distresses. I will end my lecturette by showing you a video of a cancer crusader who shared her cancer journey and which would illustrate the psychological distresses she went through and the coping tactics she used and her advice to other cancer crusaders.
Hi, I'm Chuchi Quevedo and I'm 75 years old. I am a breast cancer survivor and a member of the Cancer Crusaders Club for 37 years. On my first surgery, I was stage 1, right breast. And for my second surgery, 8 months, stage 0 cancer, left breast. What major treatment did I undergo? In both cases, radical mastectomy. No chemotherapy was advised. No, I did not go into depression. I think it was just anxiety. I was 38 years old and I had just given birth to our 4th child. My anxiety was severe and lasted for about a year during my first mastectomy. I believe the support of my husband, my family, and friends was greatly felt, so it did not progress to depression. To differentiate depression from anxiety, depression for me is despair and simply giving up, not wanting to face life's problems. While anxiety is feeling of concern for my children in case something worse happens, of feeling angry at God sometimes. I engaged myself in self-pity. I decided to resign from my job in the bank and went into a small business. How did I cope with anxiety? I depended much on my faith. In the beginning, it was not easy. Many negative thoughts came to mind, but I had a community that I got involved in. My companions guided me and always reminded me of God's immense love for all of us, that even this sickness was part of God's love. I just had to entrust everything to our God. I also got involved in the Philippine Cancer Society for a while and Sinag Hospital Volunteers Foundation for more than 30 years. I wanted to reach out to my fellow cancer survivors to tell them that there is hope. Then the Cancer Crusaders Club was established by Dr. ROJoson in 1988, and he invited me to join this club. After some time, the help of Dr. Elsie Dancel was sought due to their busy schedules. Thanks to you, doctors, I dropped Philippine Cancer Society and decided to devote much time with my fellow survivors in Cancer Crusaders Club, with your guidance and support. As far as I can remember, I did not have recurring anxiety after my first surgery. I did worry about a lump that developed near the collarbone, which Dr. ROJoson was able to remove, and another lump that appeared on my right palm, which was also excised. My second bout with cancer, which happened only last March, passed like a breeze because I was so ready psychologically and physically. Of course, there was also a bit of anxiety because I'm older, but my heart and mind were already preconditioned. I knew exactly what to expect and what to do. So my advice to cancer survivors, don't keep your emotions to yourself. Join a club or group who will be able to listen to your concerns. Reach out to other patients. You had been blessed, so be a blessing for others. Watch out for signs of recurrence. Have a regular checkup with your doctor. We all know that recently Dr. ROJoson's weekly lectures have become another source of empowerment because of our added kaalaman, kakayahan, and kapangyarihan. Last but not the least, pray unceasingly and believe in God's love. Thank you.